Hello, everyone, and welcome to Is Hemophilia a Secret? Disclosure in the 21st Century, the latest in a series of webinars for individuals, families, and caregivers affected by hemophilia A and B and inhibitors. These activities are designed to enhance and expand on the education provided at the National Hemophilia Foundation's Inhibitor Education Summits. This webinar series is supported by an educational grant from Novo Nordisk. Our presenter this evening is Kathy Tiggs, a social worker with the Hemostasis and Thrombosis Center at University Hospital's Case Medical Center in Cleveland, Ohio. Kathy has been with the center for 9 years. Joining her tonight are two panelists, David Leon and Rich Pizzillo. David has severe hemophilia A and an active inhibitor. He attends Long Beach City College and lives in Paramount, California. Rich has moderate hemophilia A, and his inhibitor is currently tolerized. He is Director of Communications for the Hemophilia Federation of America and lives in Providence, Rhode Island. Welcome, David and Rich. Our program will conclude with a question and answer segment. To ask a question, go to the area in the far lower left of your webinar screen and type your question in the field just to the left of the Send button, which is located in the pod or area labeled Chat. Click the Send button when you have finished typing your question. However, please note that your question will be addressed during the question and answer session at the end of the presentation. There are no handouts for this presentation. However, a recording of this webinar will be available shortly on the National Hemophilia Foundation website, www.hemophilia.org. Before the presentation begins, we would like to start with a few polling questions to get a better understanding of the people who are participating this evening. Have you ever attended an inhibitor education summit? Option 1, yes. Option 2, no. %66% of you have attended an inhibitor education summit. Question number 2. How many people have joined you for this evening's webinar? If none, please hit option 1. If 1, option 2. If 2, option 3. 3 people, option 4. 4, option 5. 5, option 6. Or if 6 or more people have joined you, please hit option 7. And here are the results for poll question 2. Our third polling question asks, how many people in your group have hemophilia and an inhibitor, either active or tolerized? Option 1, 0. Option 2, 1. Option 3, 2. Option 4, 3. Option 5, 4. Option 6, 5. And option 7, 6 or more. And here are the results of question 3. And our final polling question before we get started. How many in your group play a caregiver role? Option 1, 0. Option 2, 1. Option 3, 2. Option 4, 3. Option 5, 4. Option 6, 5, or option 7, 6 or more. And here are our answers for poll question 4. Ladies and gentlemen, thank you very much for answering these survey questions. I would now, without further ado, like to turn things over to our speaker, Kathy Tiggs. Kathy, you may begin.
Good evening, everyone. My name is Kathy Tiggs, and I am honored to be here tonight to present to you on disclosure. And hopefully, by the end of the evening, we can all say, possibly, that we're looking at disclosure in a different light, especially as we're talking about disclosure in the 21st century. So, thank you, and we're going to go ahead and get started. So, first of all, I want to talk about just briefly, we're going to be talking about chronic illness um, and what that means as far as chronic illness and the prevalence of it. And within chronic illness, we're going to discuss disclosure, whether of parents or self-disclosure as adolescents and through adulthood, and then the pros and cons of disclosure, and then how that fits into social media. Okay? Um, First, I went to the CDC and found out that nearly 1 in every 2 adults have a chronic health condition. And that's what hemophilia is. It's a chronic health condition. And all that means is something that's prolonged in duration. It does not resolve spontaneously. And it rarely has a cure for it completely. So as us as families dealing with hemophilia with inhibitors, we also have to know that there are chronic conditions out there such as cardiovascular disease, diabetes, and arthritis. Those are hidden conditions. Like hemophilia can be hidden, especially if there are no physical manifestations of the disease. Also, there are those conditions that are more visible to the eye or to the general public. Some of the examples I used, multiple sclerosis, epilepsy, as well as we can say hemophilia that may have some physical manifestations to it, like joint problems or things like that. So with that, opening and expanding our mind about what chronic illness is, it will also help us to determine that sometimes with chronic illness comes a lot of uncertainty. And with that uncertainty for our hemophilia patients is how will that influence my daily living, my home responsibilities for those guys that are older and have families. How will that affect my ability to work and contribute, as well as how will that affect my ability to establish social relationships and romantic relationships. And along with that uncertainty comes a lot of emotional and psychological issues. So when we're talking about disclosure, there are a couple of other layers on top of disclosure that we have to keep in mind also. And during the poll, it says that a lot of you are caregivers. And hopefully through this presentation, you'll get an understanding about, as our young men get older, that it changes, that the flow of disclosure changes from you as caregivers to the self-disclosure that they have to enter into as they go into adulthood. For hemophilia with an inhibitor, we have about 1/4 of folks with chronic health conditions where it affects their daily activities. Now, we know that hemophilia with an inhibitor, it might come with some lifestyle challenges sometimes, depending on what's going on, how long they've had the inhibitor, how it has affected the joints, and how long they have been maintained on medications and things such as that. And once again, talking about the stressors that might be associated with that, sometimes those with hemophilia and some of those limitations might want to discuss it with someone, and sometimes they may not. And the older some of our kiddos get, and I'm sorry, I always call them kiddos, but the older they get, it will determine if they want to go into that arena where the disclosure is an issue. So for the first couple of slides, we were talking about chronic health conditions. Then we're talking about how that will affect emotional and psychological impact from disclosure, especially if there are limitations or barriers, especially if we have young kiddos going into adulthood. They're going to be worried about work relationships. They're going to be worried about social relationships, and not only the relationship itself, but the quality of those relationships. So when we go back to something basic like parental disclosure, it's a little simpler to think about. So for caregivers, you have to disclose because someone else has to help you provide care for your child. So we're talking about teachers, we're talking about other professionals. We are allowing those people to have access to medical information. We are allowing physicians to talk to schools and other caregivers about recognizing emergencies and things like that, as well as you have to tell your employers as caregivers that there might be some emergencies that might come up or schedule disruptions. Sometimes this is where intermittent FMLA comes in at, and it's basically about the community of care that you provide for your child as they're younger. And friends, loved ones, and other people besides those in the immediate family, they help us to provide for our kids. Now, when we're talking about social media as far as parents and disclosure, I've found in the research that parents use social media now more than ever, of course, over these past 15, 20 years, because that's where they find a comfort zone. I quoted Thomas Jefferson here. 1786, he said, "Who then can so softly bind up the wound of another as he who has felt the same wound himself?" And that's what parents use social media for. Facebook, blogs, Twitter, there are several of them I think you can access through people that you might go to some of the inhibitor summits with to talk about just relationships and the emotional aspects of parenting a kiddo with a disease. Am I doing things right? Am I doing things wrong? Am I hurting more than I'm helping? Especially when it comes to something like discipline or equality with the siblings. So parents have found this media, this social media platform, as very helpful. When I go to some of the summits, I hear some of the parents talking about the fact that they don't know how they would have made it through if it had not been for the conversations that they attach themselves through social media. So in the beginning, we're talking about some of the questions or some of the concerns that might come with disclosure, how parental disclosure is kind of the same pretty much as it has always been because we have to make it that way. But now in this 21st century, parents have access to other people across the country that they may not have had access to before. And it's creating an avenue of discussion and support that we've never had in the past. Parental disclosure in social media, we're also talking about helping parents find a date night. You know, how do you do it? How do you get away, especially if you're a single parent? So when we're talking about those types of things, social media has come into play more so than any other time because that's an outlet that we've never had before. That's an outlet that moms and dads are finding to be very useful. Sometimes talking to friends and families, and I'm staying on this because, you know, we've got a lot of caregivers on the line, but sometimes we've heard the term familiarity breeds contempt. Sometimes when we talk back and forth with family and friends and sometimes we hear the same answers, some parents have decided to reach outside of the immediate circle to find support and answers. And I really believe that's one of the main reasons why social media and Facebook and blogging is becoming such a popular way for parents to communicate. When we're talking about parental disclosure, now we're going over to disclosure of the adolescent and going into adulthood. It's almost like a two-level of disclosure here. Parents on one level coming from grade school, intermediate school, and now we have our adolescents coming age 15, 16, 17 years old, and they're thinking about other stuff other than that circle or that community of care that's around me. They're thinking about their social networks, family and work relationships, love relationships. They're thinking about careers. When we, as a social worker, we do transition work, and along with people knowing or not knowing, the thought always comes up, what will that information do, or how will that information have an impact on my life? An example, I was at an inhibitor summit, and a mom and her son were at the front desk asking where the swimming pool was. And the mom, she very, very loudly said, well, my son has hemophilia, so we're looking for the pool because he needs to exercise. And he kind of rolled his eyes to the back of his head, and as he was walking away, he said, Mom, why did you have to say that? So when we're talking about going into a different level of disclosure, this young man, he looked to be about 15 years old, and he saw it very differently than his mother did. She said, oh, everybody knows you have hemophilia. And he said, no, everybody does not know that I have hemophilia, as he was walking away. So he's thinking about possibly at his age, at age 15, is there going to be a stigma that comes with people knowing about my condition? He's thinking about maybe the benefits of disclosure versus the negative consequences of sharing. So that was to a front desk clerk, but I'm pretty sure that if that mom came out that easily with it in the hotel lobby, I wonder how she does when she's back home, when she's with family, friends, those that might be close, those that might not be so close to the family. And this is where it might be healthy for the speaker, like mom was so used to speaking like that about her son, but it might not be healthy for the listener, depending on who's doing the listening and depending on the connection that they might have to the young man or to the kiddo that's, wanting maybe a little lid on the information, because might be thinking that there might be some negative emotions connected to it or some negative consequences. Now, we also know that when families are out of the way, parents are no longer disclosing, that there's no more of a protective barrier. Because when we're younger, our parents protect us from the backlash of discrimination coming through school. But now when kiddos are 15, 16, 17 years old, they're remembering all of the negative encounters that the parents may not have ever known about. So when they're looking at mom, don't tell, dad, stop telling everybody, they've got another layer of information that parents might not have about what has happened to them because of their disclosure, or maybe because of them not disclosing. And this comes down to whether or not the hemophilia is a visible or an invisible entity in their life, because some can go through life and nobody will ever know. And then those, especially those with an inhibitor that might have some limited mobility issues, everybody has to know for one reason or another, or possibly more people than they would like would have to know. So when I have the slide down here, concealing the severity or other aspects of the condition, as young men get older, a lot of things go into account before they open their mouths and say, hey, I've got hemophilia. So parents, as there's this transition from childhood through early teen years into adolescence, that communication has to occur as to, we're getting ready to go in front of a new group of people. How do you want to handle some of this information? Or do we even have to handle the information? So that's where the visibility or invisibility of hemophilia comes in, right there. So we know that there are some positive aspects to disclosure. We're talking about leading to better health benefits, leading to improved mental health, physical health, because there is stress associated with the secret. I had a man here at the treatment center that would not disclose at work, to the point where he would not even get on the group health insurance at work. So he ended up with less than quality health care because he did not want his employer to know. And he worked there for 16 years. And there were some times when he was here on the floor inpatient for 5, 6, 7, 8 days, to where he used vacation time and to where nobody really knew what was going on with his health. So as men get older and the consequences might be a little bit different, they decide for different reasons not to disclose, especially when it comes down to employment. So the positive aspects of disclosure, we know that they can improve health management, better social accountability, enhanced social connections. We've seen that. So disclosure is not always a negative thing, but as kids get older and there's more at risk and more at stake, young men take different things into account. So as we move into this new century of social media, there was a young man that I asked, why do you use social media? And here are some of the reasons that he gave me. And one of the biggest things is, he said, because I have people who follow me on Twitter, this is the second to last bullet, it means I have some kind of audience that is caring for me in the background. And he said that's helpful when he's having a rough day. And this was a young man who had some mobility issues, and he was in the hospital quite often. He saw me more than I know he wanted to. So um, now this next slide is about vloggers, and just really briefly, video now is associated with social media and connections and social groups. So do you know what your children are doing as far as communication and video blogging? They come in contact with other kids at the summits. How much of a quality connection are they having with other kids that they might be on Twitter with, or might be blogging, or might be using some of these other social media venues? Video chat is very big, but is the interaction a quality interaction? And that goes for parents as well, for caregivers as well. What are we talking about? What is being disclosed? And just a little bit more information that I looked at was 26% of adults use Internet to watch someone else's health experience. And then it says 16% of adults use Internet to find out others who share their own situation and concerns. So social media and the Internet and electronic medical record, all of that has to do with disclosure, because this is information that's out there and we really don't know what people are doing with it. There was a time when you knew that the one-on-one communication that you had with someone, telling them about your child's hemophilia or self-disclosure of hemophilia, we knew that that information was going to one person, but now we don't know that. Who's behind the name? Who's behind the communication and the social media name that's put up there? And is it an employer? And have we taken into account the things that we put online now? Will it have a positive or a negative effect on our kids later or on our families? Because there are still people that don't understand what hemophilia is, and they'd rather not deal with it than to learn how to deal with it appropriately. So just a little bit about physicians. Physicians are using social media. They're not sharing our information, but they are contacting each other and learning about treatment and better access and better quality care. So physicians believe that social media is a good thing to improve care and practice. But what about us when we're talking about telemedicine, which is also like a disclosure entity that we don't even think about? And telemedicine is when I'm on one end of the television or the monitor and my medical provider is on the other end of the monitor, and I'm telling them that I'm having a problem today, and they're telling me what I can do about it today. And then electronic medical records, that's also might be an involuntary disclosure that we might be doing, because once our information hits the web, where does it go? So all of these things, and who would have access to it? So if I'm talking about Rich or Dave, and David might want a job maybe in another 6 months at a company, if they Google his name, if he's done a presentation with the National Hemophilia Foundation, they might be able to see that and know what his condition is and maybe base a decision to hire him just on that fact. So when we're talking about electronic medical records and telemedicine, we need to know where that information is going and who's looking at it and how many people really have access to it. We know that our systems are hacked all the time. So are we really being protected? So I know that I went through this pretty quickly, but as we can see, there are several layers of disclosure, from that personal parental disclosure in the very beginning, and then we have young adolescents going into adults to where they take more control of who knows what, because there are a lot more maybe possible outcomes to that disclosure, as well as when we put things on the internet through Facebook and things like that, who has access and how will it impact our lives? How will it impact our families? And how will it impact the future of our young men with hemophilia? Whether it's visible with maybe limitations and limited mobility, or whether it be invisible. They might be discriminated anyway if they see information online. An employer might choose not to hire just based on their lack of information, and maybe they just don't want to deal with it rather than learn about it. So with me getting out of the way, I would love to hear from David, who's a young gentleman in college right now, who probably can give you another take, a personal take on that. And I will get out of the way and let David speak. David?
Hey there, Kathy. And pretty much disclosure. Let's see. I've been going to college and I've had my inhibitor since I was very young, few months old. So it's been with me for a very long time. And it's true, yeah. Sometimes there are things where you can't really have a bleed or anything, but because I really handled it pretty good at a young age, I just pretty much was forthwith about it, and then just I've only had one real job, I guess, after high school, and I just told my boss pretty much I simplified it for him, but I gave him the gist of the whole thing, and he still, he hired me. It was an easy job. It was just those little stands at the mall, and it all worked out pretty good, but the way I've always thought about it is just, who you should tell, who you shouldn't, because you don't have to tell everyone, everyone doesn't have to know. So I just, think of who really should know, because it's good to have a little fallback system, just in case you have a bleed and it messes up your whole either school schedule or job or anything of that sort, really. So I just try and keep it clear and, not make it a huge deal, make it seem like it's the end of the world or anything too dramatic. And I don't know, I think it's how you describe it to them. It makes a big difference, But what else? Yeah. And like in school, I would have a bleed from time to time, I remember, and it called attention to yourself. So people would ask, of course, what happens, what's wrong, whatever. And depending on the person, of course, I'd tell them. If it was a close friend, I'd just tell them something really fast, like, oh yeah, I just got a bleed right now. It's a bad, messed up knee all the time or whatever. And if it was someone that I didn't know in particular about or anything, I'd just tell them, I'll make something up, really, just to get them away from me. Just say, oh yeah, I was in the house arrest, that's why I was gone for a week or two, or something like that, and they just walk away. And it really works, And then just knowing who to tell and who not to tell really makes a big difference. But
okay.
Let me see. Yeah. I'm trying to come up with any other thing, but yeah, I don't know. I'm very forthwith about it, like I said, and it's really paid off because it's really, it's a countdown really till your next bleed. If just you're like me, if you have an inhibitor from time to time, you're gonna have one eventually. I have one every few months, so I know it might come from time to time. So I just like to have a little backup just in case it does happen. So I'd tell some people I would tell would probably be like at school would be like my counselors or teachers, and I just give them a little heads up, like yeah, there might be time to time where I might not show up if that's because of a bleed. And I really try and look for teachers that were really flexible and would really actually would be helpful and just be willing to be flexible with their schedule and willing to help you out pretty much, because it's just something that might happen, or it's going to happen eventually, a bleed if you're a hemophiliac. So I just try and hope for the best but expect the worst type of thing. And let me see. But I've never had really bad really bad situations. I guess worst thing would be like some people just don't if you explain it to them really fast, they might it's out of the norm, I guess. So some people, it really weirds them out. Sometimes, it's happened before, and it's just like I'd say it just ends right there, and there's not really any consequences to it. And relationship-wise, it's worked pretty good. I just like to. I think it's. I like the gray area, so I'm not the type of person like if I do start to like someone and I'm getting to know them better, I'm hanging out with them more, and I feel like a relationship might, evolve into that. I'll really just, ease them into it or anything, because even if I was in their shoes and someone just throws up and tells me this whole deal about, this whole chronic illness and just really drown them in that stuff really fast at very early on, and it's a turn off, I would think. So just make sure I really like the person, and and then and just break it down little by little, because they're eventually gonna find out, of course, if they're really special to you and they're gonna be around you. They're gonna eventually see you have to fuse, or they're gonna see you bleed or something. So just really ease your way into somebody and know when you should tell them and when you shouldn't, and things of that sort.
Okay.
I can't really think of anything else.
David, you know what I want to do?
Yeah.
I want to bring attention to a couple of things that you said,
Yeah.
which were awesome. You said that letting people know is also a way to weed people out. You said you weed them out.
Yeah,
so
pretty much. Yeah.
It's really not a big deal if you don't make it a big deal.
Exactly. Yeah, because if you have to sit someone down for a long time, or you make it a big deal out of sense, it really throws the other person off, because they're like, well, what were they about to tell me, this huge thing? And it really makes someone uneasy, the other person, the receiving end of the conversation.
Right.
So I just, you know what I mean? So I just put no pressure on it, and just, like, if someone has diabetes, and they just, it's not a big deal really, and everyone knows someone with a chronic illness or something. It's not something completely taboo or anything. So just easing someone into it makes a world of difference, really.
Right.
Yeah.
Okay. So you're saying it depends on how we educate the hearer, which determines
exactly, how you present it. Yeah, how you present it makes a world of difference, of course.
Okay.
Is there anything
I appreciate that.
Yeah.
And I've got one more question. Also,
for sure.
You said that you always let people know so that you can have a fallback system. I like your quotes. So
for sure, yeah.
And you want to be able to keep it clear with them. Now, have you ever needed health services on campus, or have you ever needed the help of health services in any way in order to get your needs met?
Health services
with accommodations or anything like that?
Accommodations. The only thing I think of in high school was I used to have more bleeds in my elbow, my right elbow, and so writing maybe would have been an issue. And then with my counselor, I just set it up so if I did come with a day where I couldn't use my ear to write or anything, I would just have someone come and write my notes for me and things of that sort. Little accommodations like that.
Okay.
But yeah. And like I said, just knowing who to tell is very important. Like knowing who you should tell and who you shouldn't tell makes a really big difference, Because I think it's also very, it's unnecessary to tell everyone. You know what I mean? It's unnecessary, really. You could just tell everyone that that should know. And so like teachers, counselors, coaches, things of that sort, bosses, things of that sort.
Okay.
Yeah.
Okay. Well, thank you, David. I appreciate it.
Yeah, for sure. Yeah.
Okay. Next we have Rich Pizzillo. Rich, are you there?
Yes, Kathy. Thank you.
Hi, Rich.
Hey,
Rich.
Hey, David. Great job there, and I think you touched on a couple of really key points that I'm going to address as well. So I'm going to share kind of a little bit about my story. Unlike David, I was born with moderate hemophilia, so as most moderate and mild story goes, you don't really have many major problems growing up. I was always told by my parents that I was a quote-unquote bleeder and that I was going to bleed easily, so I wasn't allowed to play sports. I was taken out of a lot of things. I kind of felt like a stereotypical bubble boy. But hemophilia really didn't play a big role. And when I say big role in my life, going to hemophilia camps or self-infusions until I was 17 years old. At age 17, I had my wisdom teeth out, and at that point is where the inhibitor was identified. So I was exposed to a large bolus of factor VIII all at once. It was the largest that I had ever had, and my body rejected it. So during that time, if you think about at age 17, age 18 is when most young adults are going off to college. So during that transition was not just identifying the inhibitor, it was a big transition in my life. It was, moving 5 hours away from home. So the inhibitor played a really big role and in a major way in terms of an adjustment. I can remember going up to school up in Vermont and waking up in the middle of the night, and my elbow would be the size of a melon when I woke up, and I didn't know what it was. It was a spontaneous bleed. So what I had to learn is that the inhibitor meant a completely different lifestyle. And in terms of disclosure during that time, I was learning how to self-infuse. I now had to get 2 fridges full of factor. And what I chose to do during that time was a decision that I don't like to live with regrets, but I would like to say that I wish I could kind of go back in time and change it, because when I moved in to my freshman dorm, I only told my roommate that I had hemophilia, and I didn't tell the rest of the suite mates. So at my college, there was 10 guys in 1 suite, so it was a common area. So there was 5 rooms with 2 people each. And what happened is when the inhibitor really started kicking up, I was infusing, whether it was 1 time a day up to 3, 4 times a day. And I remember I was only about 5 days into school at this point, and a whole bunch of guys just came barging in. I mean, at age 18, you just barge into people's rooms that you don't know. And I had a needle in my arm, and all the guys that came in just kind of closed the door, and this rumor started that I was doing drugs in my room. And I thought about that because I think about it now. And could I have stopped that rumor? No, at age 17, 18, you're probably going to have a lot of people that don't understand what it's like to be living with a chronic condition, especially hemophilia, and to be self-infusion. I think self-infusion, even for adults, is kind of this foreign concept. But I think about kind of this rumor that was going on for a while that I would hear from people that I was knowing. It's like, oh, you're the kid that was doing drugs in your room. And honest to God, that was the reputation that I got my first year at college. So when I think about disclosure, I think about how different it is now that I'm a little bit older and who I choose to tell. But during school, I kind of learned to accept it as part of me. I think for a while with any new diagnosis, you kind of go into the I don't want to share it with anyone because it makes me different, and I think that I'm green and walking around with 2 arms and my hair is red type of ordeal. But the reality is most people want to know, and it's the fear of not knowing that happens when people start thinking about, well, why is he on crutches again? He was just on crutches 2 weeks ago, and then he was off. And I found that when I started telling at least friends and teachers, it wasn't that I was getting discriminated against by then. It was the other people that didn't know me. There was a couple of times I remember as a 18, 19, 20-year-old that I came in with crutches one day, and a couple of days later I was off because the bleed had stopped. A day or 2 later I was back on because it re-bled. And one kid came up to me after class and he's like, I don't get it. You're off and on crutches. Are you faking it? Are you trying to get sympathy? And I remember getting really upset because I was thinking, well, he doesn't get it, and he's just accusing. But from his perspective, he doesn't know. And it gave me a great opportunity to explain, no, I actually have hemophilia. And the minute you say that you have a chronic condition, most people want to learn more. I will say, too, that anything that makes you, quote, unquote, different, I had during the time from freshman year to 3rd or 4th year into school, I had 3 PICC lines and 2 ports. And the PICC lines and ports were placed in my underneath my bicep. So if you look at where your bicep is and just kind of look underneath it, that's where my doctors chose to place the bicep as an 18-year-old because it was kind of hidden. I was infusing so much that what was explained to me that it would be easier to access. But the problem is that when you're wearing short sleeves and you have a PICC line with these tubes and nettings on you, a lot of people don't understand it. So of course your friends empathize with you and we make jokes about it. But I can remember a couple times, one in particular going to the grocery store, and I was in line, and the woman behind the register saw the tubes, and she kind of gave me a dirty look, and I called her out on it, and I go, well, are you curious about what it is? She's like, that's gross. And I remember thinking, well, it wouldn't be gross if you had it, and I got really angry, but it also gave me an opportunity to explain it. So I kind of took a step back, and I said, well, I have hemophilia. I infuse often. It's a central line, directly to a main vein, and this is what I have to do. And eventually, even though she was young, she kind of understood. So I always see opportunities, especially in terms of disclosure, as an opportunity to educate. Now I'm kind of, I'm 31 years old now, and I look at it as almost a game. I always wear my medical alert. And whether I'm in the grocery store and I see someone looking at my medical alert, I will just totally call someone out on it and be like, oh, do you want to know about hemophilia? Because I can see them looking at it. And I can see them being interested in it. Or even, sitting on an airplane. I love sitting on an airplane because I always end up somehow talking about hemophilia to the person next to me. And I would say 9.9 times out of 10, the individual, whether they're young, whether they're older, or male, female, it doesn't matter. They always end up walking away with, I had no idea that this was still a thing anymore. They think a lot about, kind of the older generation, about Ryan White, about, different things. But I think that there's an opportunity for us in terms of disclosure to educate. And that's really where it comes down to. I think also in terms of disclosing in school, I didn't want to disclose to my teachers at first because it made me feel different. But then when I realized, as Kathy was mentioning, that FMLA, the Student Disabilities, the Health Service Network, they're all there to protect you. There are laws in place that are there to help you. And what ended up happening was there were so many times for missing school, whether it was because of a bleed or because of tests that had to be done. My hemophilia treatment center was 2.5 hours away from my college. So every time that I had to go get a titer tested or any type of blood work, I had to travel 2.5 hours away. Well, as a college student, that happens Monday through Friday, so I could be missing a lot of school. And what I realized is when you allow yourself to talk to the appropriate people, they will protect you. There was a couple of professors in college that said to me, our absentee policy is 3 days and you fail the course. And they were pretty strict on that. In 3 days, 3 days over the semester, I missed more like 5 to 10. And they tried to really push, to say that you failed, but the disability service was there to fight on my behalf. Sometimes when you're sitting in a classroom of 200-300 people, you're just a number to them. And I hate to say it, but the bigger the school is, the more that you're just a number and a grade to the professor. So whatever you can do to get involved is don't be ashamed. And if you're a parent, encourage your child as they grow older to kind of embrace that these services are there, even as an adult now. Talk to the human resource, your office manager. Your entire office doesn't need to know. It's a very personal decision who you disclose to. It's a personal decision whether you disclose at work if you have a big office, whether you disclose to friends, whether you disclose it in a relationship. And to talk about a relationship, I think the sooner that you do disclose, the easier it is. I've seen friends in my own personal experiences when you don't disclose right off the bat to someone that you're dating or someone that's close to you, you get a lot of feedback of, well, why didn't you tell me? I am here for you. And I think a big piece too is the pain. Is how do you disclose about pain? So when you're in a relationship and you're experiencing pain, you don't want to feel like you're complaining all the time, but your partner or your significant other or even a parent wants to play a role. And I think sometimes it's a miscommunication in terms of disclosing about pain as the patient and as the caregiver. Because if I'm not saying that I'm in pain, but my mood's affected and I'm kind of miserable at the point, then the person on the other end, whether it's a mother, a father, or a significant other, is going to see that I'm moody or see that the patient's moody and not understand. So what I've kind of come down to is just an understanding, hey, I'm in a lot of pain right now, whether it's due to arthritis or whether it's due to a bleed. I'm going to probably be not the nicest person, or I'm going to try to really work on this for a day, maybe two. It doesn't mean I'm going to be miserable, but I'm just kind of not going to be myself. And when I put that out on the table, it helps quite a bit to break the ice and to know, and for my mother or my partner or anyone that I'm around, or whether it's in a work environment, to not take it personal. Because I think sometimes people want to help, they just don't know how to help. And I know Kathy talked a little bit about social media too. I think that, it's incredible to think about the world that we live in. 10 years ago, social media wasn't there, or it was there, but it wasn't like it is now, and it's only going to continue to improve. And there are so many networks out there that you can connect with, so many online forums. I mean, you can instantly sit at your computer and find a group that's out there, whether it's on Facebook or whether it's on a website or through NHF or the many other resources that are out there that you can connect with people instantly. But as Kathy was saying too about disclosure, is being cautious in what you post. A lot of colleges and a lot of jobs are now looking at young adults and scanning their, whether it's their Facebooks or Twitters or Instagrams or Snapchats or whatever else is going to come down the road, and looking to see, do they have their privacy settings up? And if they don't, people can see by what you post, oh, they just said that they have a bleed and that they have hemophilia. Technically, they can't, if you have a job, not accept you because of that, or not accept you into college. But just think about, those privacy settings on social media and what you're posting. And if you're posting in a private group, think about too about who is seeing it and who is not seeing it. So I think, there's pros and cons with everything in terms of technology. I think that there's more pros than there are cons, but it's not a perfect kind of tool. So I'm really glad that a parent that has a newly diagnosed child can have access to things like this, like a webinar, or whether it's a Skype, FaceTime, or camp. I mean, all these resources, including social media, play a big role in terms of disclosure. But I'm going to leave you with, it's a personal decision that you make, and as David said, people are there to help. I found the majority of the people that I disclosed that I had hemophilia to were very interested and wanted to help. And it's the people that I didn't tell that were the most judgmental and the most of not understanding in terms of what it's like to live with a bleeding disorder.
Right.
Wow, I told you these guys were going to be great. That's why I wanted to hurry up and get my part out of the way. But I've got one question for either one of you. You briefly mentioned your rights as a student in school, and that fell up under the Individual with Disabilities Education Act, IDEA, right? And then as you get older, it transitions over into the Americans with Disabilities Act. And that's what Rich was talking about when he was saying the Disabilities Office on campus, getting help from them. There are certain rights that we have as minors under the age of 18, as well as adults over the age of 18, when our disability possibly may get in the way of work, our ability to function under certain job titles, and we are protected. And I want everybody to know that they can look this information up, because just like Rich said, they might not technically be able to terminate somebody because of hemophilia or seeing online that he just had a bleed, but they can say, oh, we're going to downsize and we need to lay off one person. And that one person might just be the person with hemophilia who has limited mobility.
Yeah.
So those protections are there. Okay?
Right, yeah.
Yeah, I just want to kind of add something pretty quickly too. So when I and this kind of ties into disclosure as well. When I graduated college, I was pretty involved with the bleeding disorder community on a local and national level, just volunteering. And my resume, when I was trying to apply for a job where I didn't know anything about the company, it was kind of in my realm. It was with a business company that had nothing to do with hemophilia, nothing to do with the bleeding disorder community. But I thought it was a great program. It was a fellowship that I was going into outside of New York City, and I ended up getting to the third round. And I didn't end up getting the fellowship for a year, and then ultimately the job. And I asked the person that was doing the interview, can you give me feedback? Can you give me feedback on what I did wrong and what I could do better? And what they said to me was really important. What they said is, your resume was great, but it was really hemophilia related. We cannot ask you why you're related or why you are involved in hemophilia, but almost everything on there had something to do with hemophilia in terms of extracurricular activities and everything like that. We're looking for a more well-rounded person. And I thought about it. I'm like, I totally am a more well-rounded, but I didn't represent that on a resume. And that, even though they didn't hire me because of that, that was a big feature. So thinking about, too, where do you include hemophilia in whether it's a job application or talking about it, I think really plays a role in more ways than I ever imagined.
Wow, that's awesome. And that's something that we would never really think about.
No.
Mm-hmm. Yeah, exactly.
Yeah. Now, I think we want to get some questions and answers out to our participants. Susan, are you there?
Yes. Thank you, Kathy. We'll start with our first question. And it asks, how often do you use social media for health information and support? Option 1, very often, at least once a week. Option 2, fairly often, at least once a month. Option 3, occasionally when a particular issue comes up. Or option 4, I don't use social media for information and support. All right. I will share these out.
Wow, that's very interesting. So we have very often, at least once a week, we have 33% of the people. But what's even more interesting is 50% say that they don't use it at all. So, when I did the slide about how parents connect to one another, how doctors are using social media, and how they're finding it such a positive way of communicating. Those of you that have not used it, I would like to wonder why, even though we're not set up for that question right now, but is there something about social media that you might not trust? Or maybe you may not have known about some of the access and opportunities that you have. So just in case that's it, there are many opportunities online for you to connect to other families, other parents, and other folks. If we have anybody online that has hemophilia, there's a lot of folks out there that you can access and connect to get some of your questions and laughs and tears and all of those things kind of out there. So that's awesome.
Thank
I'm
you,
sorry,
Kathy.
Susan. Okay.
Our next polling question asks, do you have concerns about access to important health information once it's on the web through Facebook, Twitter, blog, or vlog posts? Option 1, yes, or option 2, no.
Wow. So 71% does have concerns. That speaks volumes right there. And that sounds like me. I'm an old schooler. I'm kind of older, and that was one of my main concerns. And folks like Rich and Dave and some of the folks at the National Hemophilia Foundation, they're trying to pull me into the 21st century, but I can definitely understand that, why those numbers look that way. But when Rich said one more thing. Rich did say, though, if you just kind of take a look at your privacy settings and things like that, and some of those personal closed, and Rich, please help me if I'm phrasing this wrong. Those closed chats that you can be a part of.
Yes.
Is that what you were saying? Okay.
Yeah. So there's a lot of more than I can keep track of personally. A lot of closed groups on Facebook where there's usually a moderator who will vet out who they let in, and usually you have to have a bleeding disorder to let in, or it's by invite only. But still, I would recommend thinking before posting. Even though things could be deleted, it's through a computer screen. There's no voice. Things could be taken the wrong way. I've seen a lot of people giving diagnosis that probably shouldn't be given diagnosis. I think any medical question should always be directed back to your hemophilia treatment center and not not via the computer.
Right.
All right, we'll go to the next polling question. What is your biggest concern when it comes to social media and personal health information? Option 1, privacy being infringed upon. Option 2, misinterpretation or misunderstanding of information by others. Option 3, exploitation or misuse of information for profit entities. And option 4, complicating or jeopardizing current future employment.
Okay, once again, we're looking at privacy being infringed upon. And like Rich said, yes, being very careful before posting. Okay.
Thank you. Our last polling question asks, do you have concerns about personal health information being transmitted over the web via an electronic medical record? Option 1, yes, I have concerns about issues such as confidentiality and security of information. Option 2, no, I have confidence in the system. Or option 3, the jury is still out. I need to know more.
Well, wow, that's 50-50. I would like to say, as I was researching this topic, disclosure and electronic medical records kind of came together because when we allow someone to electronically send us our health information or to make appointments or to fill prescriptions, lab results, things like that, I don't think all of us really know that once it's on the web, once it's out there on the wire, that other people have access to it. So that's the reason why I wanted to put this in here, just to give thought to it, because I never thought about that. I never thought about if somebody wanted to look hard enough, they might be able to access my medical record if I've allowed my doctor to send it via email. And then what could that lead to? So that opens up a whole nother can of regulatory systems and technology that we're probably not even ready to discuss at this point in time because it's so new. So, and the jury is still out because of that. So thank you.
All right, then we are ready for questions and answers. Ladies and gentlemen, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. If you would like to ask a question live via your phone, press star 1 on your telephone keypad. I will announce each caller prior to bringing you into the conference. Please remember, if you have your phone on mute, take it off mute when you are selected to ask your question. Once again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. To ask a question live, press star 1 on your telephone keypad. We do have a question for either panelist. Did the choice to disclose or not to disclose ever adversely affect your health?
It's a really interesting question. David, do you want to go first?
Yeah, go for it first. Yeah, it's such a broad question. I don't know how to start it off.
Yeah. So I think I want to say no. I don't think that it affected, well, physical health, no. Emotional health, yes. I think that physically not disclosing didn't really affect me, but not disclosing and playing the game in my head of who to tell and who not to tell definitely played a role. I can definitely remember at age 18, many nights of being in pain and not telling anyone and sitting by myself with ice and watching movies when I know most of my friends in college would totally chose not to go out and would have just hung out with me eating ice cream and popcorn and making jokes. But I chose not to tell anyone that I was in pain or having a bleed and just made up an excuse that I was sick. So I think like that type of stuff affected my health because I was just kind of miserable some nights. But I think physically, no.
Yeah, I would tell you what with what Rich said. Yeah, because physically you could just withdraw yourself and infuse properly, or whatever. But to disclose, yeah, it is a psychological issue whether you tell someone or not. But yeah. I think that. Yeah, well, you said it all pretty much.
All right, thank you. We do have another question for the panelists. Looking back, did either of your cultural and or family backgrounds contribute to how open you were to disclosing to others?
Yeah, but the only question is, I don't know, you have to understand other cultures, I guess, and other stuff, but within my own personal family, it was pretty much from, forward. Everyone in my family and friends pretty much knew, and I don't know, everyone rolled with the punches. Like everyone just, since I had it since very young, everyone just told him, oh yeah, he has a bad knee or he has hemophilia, so he might be bad and he might be sick from time to time, and everyone just very much accepted it. Since I've had such a young age, it was very understood. So I never got really, left out of things from my family-wise, I guess, otherwise.
Yeah, I would say that for me it did. I come from an Italian background on both sides of my mom and dad, and especially from old school Italian, men are supposed to be strong and not show emotion. So I grew up with men don't cry and you don't complain about stuff. So I think when the inhibitor kicked in and there was a lot to complain about and to cry about, I held it in quite a bit. And it was a breakdown for my father as well. Not so much my mother, but to understand that this is pretty serious and that it's okay to cry. I mean, I can remember being in the hospital during kind of the peak of the highest inhibitor and just a whole other, complications as a result of having one. I was in the hospital straight for almost 3 months with a whole bunch of things going on, and my dad it was kind of the first heart-to-heart that we had together, and it was the light bulb clicked for me of saying, this is not because he's trying to make it difficult. This is just how he was raised. It's just how the culture was that, men provide and men do this and men are very stoic. So I don't think it's right or wrong. It's just I think how some cultures are. But it's definitely helped helped my family to see things a little bit differently.
Well, that was the last question. Kathy, any final remarks before we end tonight's conference?
Well, I just want to thank everybody that signed on and participated tonight, and hopefully we were able to leave a couple of golden nuggets behind for you to think about that you may not have thought about prior to signing on. So I just wanted to thank you, and have a good evening.
Thank you, Kathy, and to our panelists. Ladies and gentlemen, your feedback is critical to us, not only in measuring the efficacy of this webinar, but also in the planning of future inhibitor-related activities. Please complete this 5-minute survey appearing on your screen now by clicking the link. Thank you for attending. This concludes our program.